Epinephrine is difficult to dose. We talked about the different concentrations and doses in a previous video. Remember that we want to use 1 mg per ml epinephrine intramuscular for situations like anaphylaxis. That's also called 1 to 1,000. We want to use 100 microgram per ml epinephrine intravenous in cardiac arrest. That's also called 1 to 10,000. So when it is time to give IV epinephrine for pediatric cardiac arrest, or a peri-arrest bradycardia despite oxygenation, ventilation, and chest compressions, how do you remember how much to give? With all the different doses and concentrations of epinephrine swirling around in your head, you need to pick the right one without wasting time and brain power trying to figure it out. We need a memorable technique that won't fail us when we're stressed. And here again, it's our friend Alison Inaba to the rescue. This time we're going to use a technique that he calls sliding the decimal. So here's how it works. You take the child's weight and slide the decimal to the left once. That's it. That's your volume of cardiac arrest epinephrine in mLs. This is the most important number to get right because it's the number that the person giving the epinephrine wants to know. Dr. Inaba is from Hawaii, so just picture that decimal sliding down a wave to the left one spot. And if you forget which way to slide the decimal, Dr. Inaba recommends a little reminder from Beyonce.
To the left, to the left.
So the scenario will go something like this.
I don't feel a pulse. Let's start compressions.
I'll start compressions.
How much epinephrine do I give?
How much does he weigh?
12 kilograms.
1.2 milliliters of 1 to 10,000 epinephrine.
Okay, I'm going to give 1.2 milliliters of 1 to 10,000 epinephrine IV.
Yes.
We can take a minute to compare this to an adult. That's always a good way to mentally double check your pediatric dosing. We'd give an adult the whole 10 ml syringe of epinephrine, which would be 1 milligram, so 1.2 mLs for a little patient makes sense. To give that patient the whole syringe, or a fraction of an ml, probably wouldn't make sense. So that's the most important part of sliding the decimal. Slide once to the left, and that gives you the mLs of cardiac arrest epinephrine to administer. And you can give this dose every 3 to 5 minutes. For documentation purposes, though, you may want to know how many milligrams of epinephrine you've given. Slide the decimal to the left again to get this number.
How many milligrams is that?
1.2 mLs is 0.12 milligrams.
0.12 milligrams in the chart.
So think about it this way. Kilograms slides to milliliters, which slides to milligrams. Okay, let's do another example. Let's say we have a 5-year-old cardiac arrest. Using finger counting, we estimate the weight at 20 kilograms. Slide the decimal once, and we know we're giving 2 mLs of cardiac arrest epinephrine IV. Slide it again, and we know the quantity of epi we just gave, which was 0.2 milligrams. Now we can document what we gave. This may seem intuitive now when you're calmly watching this on a screen, but you'll realize the genius of this technique in the moment when you're stressed out and the last thing that you want to do is math. One last note, don't forget that pediatric cardiac arrest usually has a respiratory origin, especially in previously healthy children. For this reason, some people call it pulmocardiac arrest instead of cardiopulmonary arrest. That's why all the PALS pathways emphasize oxygenation and ventilation. And there's poor evidence that epinephrine actually makes a difference in clinically important outcomes in cardiac arrest. So remember the importance of good ventilation and oxygenation. So now that we know that all we need to do in order to dose epinephrine in pediatric cardiac arrest is slide the decimal once to the left, epinephrine's getting less intimidating, isn't it? Now it will be one less thing to think about during a pediatric cardiac arrest resuscitation, and you'll be able to use your brain power on other parts of the resuscitation.